US President Joe Biden says the new Omicron variant is a cause for concern, but not for panic. Several countries, along with the US, have clamped down on international travel now. They include Japan, which has banned all foreign arrivals. Morocco has halted all inbound flights, and Israel has closed its borders for 2 weeks. The US, Brazil, Australia and Indonesia are among countries to bar travellers from southern African nations where the variant was first reported. Now, along with cutting air links to southern African countries, the travel bans have had the knock-on effect of leaving thousands of travellers stranded.
All they want is to go home, but since the new coronavirus variant Omicron was first detected in southern Africa, travel restrictions around the world have tightened. Flights got cancelled, and these travelers in South Africa are still looking for a way out.
I flew in on Tuesday to Joburg from the UK. Obviously, the bans came in Thursday, Friday, and so I got stuck. I think there's several thousand Europeans trying to get home via the only routes available, which I think now are Kenya and Ethiopia.
It is frustrating because it was a short holiday and then it turned out to be a nightmare.
US President Joe Biden says they are not planning additional travel restrictions and defended the ban on visitors from southern African nations.
It gives us time to take more actions, to move quicker, to make sure people understand you have to get your vaccine, you have to get the shot, you have to get the booster if you're. This variant is a cause for concern, not a cause for panic.
With people around the world tired of pandemic restrictions and another round of lockdowns and travel bans, the World Health Organization is urging the global community to be cautious.
We shouldn't need another wake-up call. We should all be wide awake to the threat of this virus. But Omicron's very emergence is another reminder that although many of us might think we're done with COVID-19, it's not done with us.
With little information yet about how dangerous Omicron is, some nations have walled themselves off entirely, like Morocco. It has suspended all incoming air travel for 2 weeks.
And we can get more on this with journalist and molecular biologist Kai Kupferschmidt, who joins us from here in Berlin. Thanks so much for your time. Now, the WHO has assessed the overall risk from the Omicron variant as very high. What do they mean by that exactly?
Well, this is still based on the same information that we've talked about in the last few days. It's not different from what the European Centers for Disease Control said a few days ago as well. It just means the genome of this virus really looks like it could have the ability to evade immunity to some extent. It could transmit very well. And of course, that would be a problem. And the first indications we have from the little data we have in South Africa suggest that that might be happening, that it could replace Delta. But again, we don't know that yet. And so they're just being cautious. I mean, that's why they've called it a variant of concern, and that's why they're saying there's a high risk.
OK. Now, the CEO of the vaccine manufacturer Moderna has said that COVID-19 vaccines are unlikely to be as effective against the Omicron variant as they have been previously. So what does this change? How does this change the global vaccination effort?
Well, again, that is something we're going to have to see. I mean, clearly, everybody who looks at that genome, who has any understanding of antibodies and the sites that the antibodies bind to, is really concerned because these are the sites that are mutated in this virus. But we're going to have to wait and see how big the drop is. And that's going to decide about how much of an impact this has really globally. Certainly, it could be possible that we need to update the vaccines. That's something that people have talked about for a long time already. Luckily, it hasn't been necessary so far. And then, of course, we're going to run into all the same problems that we've run into before, which means we're going to have to produce massive amounts of a vaccine in a short time period. And from what I've seen so far, we're not going to be able to distribute it equitably across the globe unless we really redouble our efforts on that front as well.
Now, Omicron is the latest in a string of coronavirus mutations. People are tired of the ongoing restrictions. How many more mutations are we likely to see? Is there any light at the end of the corona tunnel right now?
I mean, that's of course someone nobody can tell right at the moment. What we have seen, this virus has been surprising in just how well it has been able to adapt, not just to humans, also to a host of animal species. And I think that's something that maybe a lot of scientists also underestimated in the beginning. But certainly everybody has always said, it takes two things for evolution. One of them is that these mutations have to come up in the first place, which is essentially chance. So the more infections you have, the more likely you are to get any evolution at all. And then the second part is an evolutionary pressure. Now, as this virus sweeps through humanity and immunity builds up and we vaccinate people, which also builds up immunity, of course, the evolutionary pressure is there. So all we can do at the moment really is to reduce the number of infections globally and cut off these ways for the virus to evolve around our defenses. But we've been doing a very bad job of that, I'm afraid. And as long as that continues, the chances are that the virus is also going to continue to evolve and find new ways to make trouble.
All right, Kai Kupfer-Schmidt, many thanks for your time.
Thank you.
Earlier, we spoke to the World Health Organization spokesperson Christian Lintmeier in Geneva, Switzerland, and we asked him if the Omicron variant is more dangerous in countries with low vaccination rates, such as South Africa.
That's difficult to say yet because we don't yet know the severity of this virus, of this variant. So Omicron is not yet fully known. It looks like it's more transmissible. That's what the preliminary evidence shows, that it might also break through immunity possibly easier. But we do not yet know much about the variant, and we do not know whether it's more or even possibly less severe. So we have to wait for that to see. But yes, the more a virus spreads in a community or a society which is less vaccinated, the higher the risk that we have more severe cases there, that we have more people in emergency wards and therefore blocking up the healthcare system, and therefore also enabling in a chain reaction other diseases to come up. Let's not forget, this is not an isolated show. And if one society is hit by that, then again, we come back to square one. Then the virus will mutate and change and will come back to us all. So yes, we need vaccines out there to as many people as possible, but on your personal level, if you are offered a third shot because of your your immune system is maybe requiring it and you want to get your immune reaction up, then yes, you should take it. But on the national level, let's try to share as much as vaccines as possible with those who need it.
Turning to Germany now, where Chancellor Angela Merkel and her likely successor Olaf Scholz will be holding crisis talks today on tackling the pandemic. Although the country's 7-day incidence rate has fallen slightly, some hospital wards are full, and the incoming government is under pressure to make vaccinations mandatory.
No customers at this vaccination centre in the German state of Saxony. The region has the highest coronavirus caseload in the country. Vaccinating the population a high priority, yet they don't have the doctors to administer the vaccine.
It's really only a matter of personnel. We do have enough vaccine, but we have only 2 mobile vaccine teams for the entire district.
Hospitals here are at capacity. ICU patients need to be transferred across Germany to guarantee care. A crisis that can only be managed through additional vaccinations, say scientists.
Our data shows that both vaccinations and booster shots do really make a difference. If we vaccinate quickly, we could break this wave in December.
Germany's incoming government says all options are on the table, including vaccine mandates.
The question is whether we need to move the school Christmas break forward, and we need to discuss and prepare a vaccination mandate.
Hard choices for outgoing Chancellor Angela Merkel when she sits down with regional leaders later today.
All right, let's bring in DW's chief political editor, Mikhail Koffner, who can tell us more about all of this. Mikhail, Chancellor Angela Merkel and her successor, Olaf Scholz, as we just heard, will be meeting with the leaders of Germany's 16 federal states today. Can you tell us more about what they'll be discussing?
Well, they're clearly discussing what the next measures will have to be in the face of the fourth wave of the pandemic. It's safe to say that both the now departing government of Angela Merkel, but also the incoming government, have been caught off guard by this full force of the fourth wave. Only today, after more than 3 weeks, we're seeing a stabilization in terms of infection rates, which are still above 400. So things that had been initially ruled out, like mandatory vaccinations, which parties across the board had pretty much ruled out, and now being discussed for real. Also, potential contact restrictions. Nobody wants to use the L word, the lockdown word, because that is something that parties have been increasingly shying away from, because there were also constitutional alarm bells ringing, particularly amongst delegates or MPs from the Free Democrat Liberal Party, who launched proceedings before the Constitutional Court on this.
That's right. Now, the German Federal Constitutional Court is actually set to rule today whether a nighttime curfew and strict limits on social contacts that were implemented last spring were, in fact, unconstitutional. How could that impact the current fight against the fourth wave?
Well, it will make all the difference, because the Constitutional Court, which initially was thought to rule way too late to really make a difference, is now coming right in the midst of this fourth wave, and it will rule on a whole host of measures, also including school closures, but the whole question of lockdown, the emergency brake measures that are now no longer possible because the incoming coalition had those suspended, introduced a new set of measures, a more limited catalogue of measures. Now, we're talking about fast, massive expansion of those again. And here, politicians actively waited until after this Constitutional Court ruling to make sure whatever they launch from now will not be contested within the court within days.
Now, Germany says it wants to administer 20 million booster shots before the end of the year. Is it on track to do that?
Yes and no. We heard BioNTech now pledge to 3 more millions of doses that could be delivered here in Germany. But as we saw in the report, it's very sketchy. In some places, there's no personnel. In other places, there's not enough vaccine. And that's also why a new drive is now being launched within the incoming chancellery, which is to be headed by someone from the military, at least projecting kind of military-style logistics and operation. Whether that will translate on the ground when, for instance, dentists and will be asked to join this drive, that's a big question mark for now.
All right, DW's chief political editor, Mikhail Koffner, thanks so much. And here are some of the other developments in the pandemic around the world. Chinese President Xi Jinping says his country will send an additional 1 billion doses of COVID-19 vaccines to nations in Africa. Britain will offer a booster shot to all adults in a bid to accelerate its vaccination programme. Face masks will be compulsory in shops and on public transport in England from today. And the Philippines have launched a 3-day drive to vaccinate up to 9 million Filipinos. Tens of thousands of military and police officers, plus thousands of volunteers, have been deployed nationwide.